The problem that we identified was that we weren't necessarily always getting it right in relation to delivering the right resident outcomes.
We were noting that there was inconsistency in practices, people were becoming quite task orientated rather than person centred.
We put a lot of staff through training, we pay a lot, we put a lot into our training budget every year, and we felt that we weren't always getting the best outcomes from the staff that had gone through the training. So we were receiving things like customer complaints, we were finding that people with very complex needs were having to move into more specialised services.
We needed something that would be able to benchmark where people are now, where their knowledge and where their confidence and their skills sort of in the care practice was. The impact that we noticed with the Cognisco dementia key skills was that people's confidence was rising.
Where would you like to sit? Before the training, I was going into the household pretty much blind. Even though we knew each other as individuals, the way we worked, we didn't know each other's knowledge gaps.
What we've also developed is an hour sort of training session, so what we can do is tailor training to that team.
The staff themselves are feeling that they are providing better outcomes for the resident, that they feel more empowered to make decisions and to make leadership decisions. And when I talk about leadership, I'm not talking about the people at the very top of the organisation. I'm talking about people, our support workers, our team leaders, lead staff that are supporting people on a day-to-day basis, and they're being prepared to make some changes and to challenge the status quo and to change culture within teams.
I think leadership is definitely coming through, and I think people are recognising you don't have to be a leader, the title in your role, to be a leader.
Where it's really had the most effect is where leadership's happened on a very local level and people have embraced it and they've really wanted to carry it forward and make some changes.